All right, so this is Giovanna for mn662 therapy week 6. For my journal entry, describe a significant event or patient interaction you have experienced and discuss the impact this had on you in terms of increasing your understanding of the PMHNP role, psychotherapy, and or the provider-patient relationship. So I'll discuss a patient that she was actually 17, couple of weeks off from her 18th birthday, and she was well known to us. We've had her, I've had her for the last 3 years. And she's a DCS child, so she is custody of the state. She usually runs away from, whatever group homes that she's placed in through the state, and always finds her way back to her boyfriend/pimp. So the first time I had her, it was impacting to know, at 14 that she was being pimped out. And then as the years went by, I could see her change in her self-esteem. Every time she came back to us, the suicide attempt was different. She started with self-harm, so she had a lot of scarring on her upper forearms, on her thighs, and it was never about the life that she was leading. It was about, or the choices that she made. It was always about the boyfriend or the pimp finding someone else or leaving her. But the lifestyle, so, after several times of having her, I asked her, without even really knowing about, the therapy modalities or motivational interviewing, it was a conversation with her about, okay, so the life that you're leading is intriguing to you, right? And oh yeah, I love everything I get. I love being able to go to the mall and buying whatever I want when I deserve it. And I remember asking her, so what activities had to come for you to deserve the mall? And her face would just kind of like, you could see it just like, we're not going to go there, So after, several times talking with her, it was like she understood the fact that this was the way that the boyfriend pimp was like putting a carrot in front of her. And so after reviewing like motivational interviewing and trying to get a patient to see their own behaviors and the consequences or understand the outcome of their behaviors, it's important, even if it's not in therapy, but as a mental health provider, learning how to motivationally interview and without breaking that rapport with the patient. With kids, I find that it takes time, and unfortunately, as a floor nurse, you don't have that time. But as a nurse practitioner, I can see utilizing these therapies a lot more with my patients to understand where they're coming from, where they want to go, and how I can help intervene with that, with either a medication or therapy, or a recommendation to an outside source. Like, for example, my preceptor in my previous class was a peer of mine, was a breathing coach, or breathing coach, yeah. And I took a couple of lessons, and it was like, whoa, it was pretty cool. Although it's private pay, it's something different. It's something that, just think of breathing, and it's something that can help. So, yeah, and just increasing my motivational interviewing can really help me get to know my patients better. And then explore your personal strengths and limitations and their effect on the provider-patient relationship. So my strengths are finding words to not pry. So I like to listen. I don't like to, if they're just talking, they're expressing themselves, I like to have that eye contact with them. I like to, give them some kind of physical movement that I'm listening to them. And my limitations, I feel like when a patient doesn't go on our agreed goal, like I'm failing them. So I know that that's something I need to work on. I think especially all my preceptors have told me the first year or two, you're going to feel that way. And then you start to really understand that you're giving them the best that you can, and ultimately it's their decision. And I remember feeling like that as a new nurse, like I want to do the best. And unfortunately, sometimes you can't change them. All right, I'm running out of time. Sorry. Include, reflect on your therapeutic use of self. I like these videos. I think that even after, God willing, I finish and I pass, I want to do these videos. Like I actually go back and I watch them, and I see my face, and I can feel the expression or the frustration. So I want to continue to do this self-reflection via video. Your discussions should reflect a specific learning insight. So yeah, motivational interviewing is pretty cool. I've actually been listening to some podcasts on motivational interviewing and how to ask open-ended questions. Like don't ask yes or no, like instead of how's your day today and having a one-word remark or a response, it's how is your day different today from yesterday? So that I've been using that. Identify something specific that you learned from reflecting on this event, and how will you apply that learning in your future practice? With my kiddo, I learned that kids, it's a sad world. The system is the way it is. And I can do my best to offer some type of guidance and care while they're with me. I also learned that personally that I took that case home for a long time. And every time I would see her, it's like getting worse and worse. And as a nurse practitioner, I think that having a patient like this, perhaps intervening a little bit more with DCS, and I know you can't with every patient because you're extremely busy, but I think someone that keeps hitting that door for the same reason deserves a little bit more. I think that that's something I took with me is, as a nurse practitioner, don't forget that I'm there for those patients. And if this is their second, third time in a level 1, maybe as a provider have a little bit more of say or push with the state to do collaborative teamwork and figure out a better outcome for this patient.